be a podiatrist. I wanted to go to just regular medical school, but I kind of just fell into podiatry. But interestingly, people neglect their feet a lot. And they don't realize how important their feet are until they have an issue. Hence, some of the things you've seen me post on social media. My patient population here is varied, but the majority of patients are diabetic patients. And interestingly, a lot of African American patients are my kind of people. And the African American population is probably one of the highest demographics as far as diabetes is concerned. So we see a lot of different things, like the stuff I post on social media, plus a lot of stuff that I have yet to post. So, coming attraction. I'm going to post some more stuff.
So, Dr. Vaughn, I just recently seen you post that you took your second COVID-19 vaccine. You know, did you feel any type of side effects yet?
No side effects. I took it about 2 weeks ago, the first dose. It was the Moderna product, so it's a 4-week lag between the first and the second dose. So my second dose is the Monday after next, the 25th. But no side effects, just some arm soreness for about 24 to 48 hours. I felt it was imperative and important for me, because I have such a social media presence and following, to show that me as an African American have faith in the scientific community and faith in the science. So that was one of the reasons why I took the vaccine. And then I had to ask myself, what's the alternative? You know, you take the vaccine and have protection versus getting COVID and possibly losing your life. So it's so important for us to realize and show people that the vaccine is not harmful to us. And there was a study that came out that said, they asked people, are you willing to take the vaccine when it's available? And 46% of African Americans said that they would. That's the lowest from our Hispanic counterparts and our Caucasian counterparts. So it's important for people who are in our arena, who have some type of a presence, to show that the vaccine is safe.
I just recently heard someone took the vaccine and they caught it after they took the vaccine.
Education is key. I think a lot of people are stuck on the Tuskegee, Tuskegee Project back in the day, where African Americans were exposed to and so everyone's afraid, of course. But that case where someone took the vaccine and then developed COVID right after, it takes a little bit of time before our body develops immunity. So you conceivably can get the vaccine on today and develop COVID 2 days later, because the body has now built up immunity for that. Now, after you take the first vaccine, we're thinking that you're 60 to 65% immune. But after the second, you're about 95%. But even after you take the second vaccine, it takes several weeks. We're saying about 2 to 3 weeks before your body actually is at the point where you say, hey, I'm pretty much immune from this. So it just depends on when you took the vaccine and when you contracted the virus. So you can't do that. And I know that was on TV and on social media. People were quarreling about vaccine. I'm not taking it because somebody took it and now they got COVID. But if you're in that window, you have to realize that it takes time for your body to develop antibodies. So that can happen. Yeah. So that's why they say it's when you can't consider yourself invincible even after you take the vaccine, because there's still time for your body to develop immunity. So you still got to do all the social distancing, wear your mask, and all the mitigation measures that we're doing to kind of reduce the numbers. Yeah.
Gotcha. Okay.
So this is actually our vascular machine where we do a lot of the circulation studies on patients who have peripheral vascular disease or patients who are diabetic. So we don't have to necessarily refer patients out to have those studies. We can do it in-house. And therefore, patients are less exposed to other people. They can just have everything done here. I like it to be a one-stop shop. And if there's an issue when we do the study, we find something, of course, we'll refer them out to necessary practitioners if we need to. Now, you talked about toenail fungus and the stuff that we were talking about earlier.
Correct.
So this is our laser, and it's a painless treatment where the laser light, which is really heat, it actually kills the fungal cells in the toenails. It also can be used for pain as well. So this is something that sometimes patients don't want to take a pill, for toenail fungus, or they don't want to put a nail polish on every day. So this is something that they come and they do it right here in the office. It takes about 3 or 4 treatments, and you should see some decent results. It's about 75 to 80% effective for toenail fungus.
Okay, ladies, you hear this? You know, for all the ladies who are wearing the 6-inch heels that always complain about their feet, go see Dr. Ron.
Yeah, y'all need to come on in and get those toenails. Don't walk around with
All
bad
my
toenails.
celebrity friends and people, visit Dr. Ron. He's
That's
the
right.
one.
That's right. We'll take care of you.
Okay.